what should organizations look at when trying to reduce labor costs, but then in turn, really not compromising care delivery? What are some of those levers that are important there?
Yeah, and I think it's really two questions, right? So first, I think it's important to focus on the revenue impact and not just the cost containment, right? So that the staffing constraints, directly affect the ability to generate revenue for healthcare organizations, right? Which also makes workforce planning a financial priority. Of course, keeping beds open, right, and opening beds for growth, right? That directly drives revenue through, patient throughput, of course. Increasing the surgical volumes, right? So major revenue driver, ensuring you've got the right clinical staff or the clinical staff in place to optimize OR and peri-op and reduce, any surgical backlogs. And that's where in today's market, we are seeing more of a specific focus or a micro focus, being able to support peri-op, as a specific approach, right? And take that off of the internal TAs team. So it's more of duplicity, right? Additive to being able to support the needs to make sure that, surgical volumes are met. And then the other piece is expanding services, right? Every healthcare organization, for their communities, always expand the services. It could be for behavioral health, it could be opening new clinics, and it could be, additional points for ambulatory care. And so ultimately, being able to align the workforce strategy or your approach will help make the case to be able to have the staffing and the opportunity to support those. Now, on the flip side was, okay, what's the strategy to mitigate costs? And that's where, what we do is we work with our clients to help identify what's the cost. What are those costs of vacancy hotspots, such as, right, there are areas, units of highest vacancy rate, highest agency utilization, premium pay, OT usage, international staffing, right? Helping them to understand and rethink what their float pool utilization is, what their PRN utilization is, what's that mix, right? And I think it's critical then to kind of co-design that to reduce the premium labor reliance and minimize FTE leakage. So, in today's environment, there are some organizations that either have knowingly or unknowingly driven up their overtime usage to a level where it costs more than utilizing a traveler, right? And without realizing it. So they are escalating their internal operational costs, right? And then the other piece of that is we see organizations that are trying to manage their float pools. Sometimes they're very siloed. They could be within the units, they could be within a hospital, sometimes centralized, but they're not benchmarking market rates, so oftentimes paying more of a higher rate of pay. We've seen them also adding on or providing surge pay as well, and sometimes even some benefit offerings. So without visibility, and I'd say the other piece to that is also not being able to have the visibility into the a worker being fully scheduled to their FTE commitment. So that goes back to the FTE leakage, right? So to me, this is the one area that if there is significant, significant results and also, tied to untracked cost overruns, this is the biggest area of impact that can be approached by healthcare organizations.
Yeah. Brian, I'd love to, I'm sure some of your thoughts are very similar to what Jim just mentioned, but would love to hear your thoughts as well on some of the factors that are important for leaders to look at when really trying to balance this out in terms of cost and care delivery.
Yeah, I mean, part of it is just let the data help make the decisions, right? It's, we all have a lot of experience. And so, that's really valuable. And the intuition and just, going through reps is served us well. But ultimately, you also want to step back and say, what is my total cost of labor and staffing across all different, whether it's, using contract labor, permanent labor, look at the all-in cost. We know a lot of times P&Ls, you've got kind of your labor line and you've got contract labor sits kind of in your other costs. And so you're not really look at it all in one holistic way. The good news is that the data is there, and you have a lot of different tools now to be able to pull out together and really do that analysis. And to Jim's point, you look at the spread these days between core staff. JB mentioned all that wage inflation, and when you layer in benefits and cost of hiring and cost of turnover, and you compare that now to contract labor rates, in some cases, it's actually can be lower cost to bring in outside labor. And I think it's just a hard thing for leaders to get their head around. but that's the environment we sit in today, particularly if you're a union organization where you probably have incrementally higher costs and also less flexibility in terms of how you adjust your staffing levels. Using a blend of perm and contingent labor can actually be far more cost effective. And we've sat with leaders on the CFO side that when they go back and look at, they realize, wow, we've tried so hard to bring down contract labor. Now I look at where I'm seeing this growth in overtime, or we're seeing more wage inflation. You really need to sit down and do the math on it, and you might find that your mix should be a little bit different than what your intuition may tell you is best. It may be a different answer. And so again, the data is there. It's just having either the right teams internally or using outside partners to help you sift through it and come up with the right staffing model that for the long term is going to drive more efficiency.
Yeah. JB, that's where we're coming back to sort of the evaluation piece, right? You need to look at, as Brian mentioned, the data, but then also evaluating what does this look like from a practice perspective in my environment, in my real environment where I'm working. What does this look like for you?
Well, what I look at in these departments, and once again, I'm focused in kind of on the micro rather than macro from a recruitment perspective. And it's similar to the last question. Even if you look at some of those higher revenue generating departments, what could you do if these departments were better staffed? So what is that? I'd say the department kind of has that fear of missing out. What could you really do there? One of the best tactics, and we do this on our RPO and direct hire teams, but you can do it internally as well as long as you've got the resources. It's to build kind of a strike force. I call it a SWAT team, but it's a high accountability, multidisciplinary team that's really focused in on achieving a goal, a staffing goal within a specific department. So if you think about this, you've got, if your talent acquisition team has sourcers, people who actually go out into the market and generate interest, candidate interest, you pull them, you pull talent acquisition, you pull in your onboarding HR team, pull in operations, your nursing leadership, and even into finance leadership and within your C-suite. So you build, okay, what is our unified goal? So say it's peri-op. We're depending too much on premium labor, overtime, things like that within peri-op, and we need to get to a certain staffing level. So you bring the organization together to focus in, really super focus on this one department, and then you create accountability. So there needs to be weekly or bi-weekly updates, so we make sure there aren't any gaps in that process. But remember, you can't put it all on one hiring manager. You've got to create a team behind them where they can evaluate candidates and hire the number that they need to. Keep in mind the proctoring and the training that has to happen too when you hire 10, 12 new providers in a specific department. Generally, when we do that, it takes about 90 days, and we're reached the staffing goals, and we're able then to shift the entire apparatus over to another department.